We're going to start the meeting. The select board is also going to be meeting tonight as a courtesy because of the guests that we have tonight to discuss their budgetary requests. So at this time, we will begin the budget committee meeting. And we will first, we should read the minutes first. Can we, at this time, take a motion to accept the minutes from the previous meetings?
Motion to approve.
Second.
I'm going to have a discussion.
Yep, that discussion comes now.
I'm
Teresa?
not agreeing with November 5th's minutes. Nowhere in my minutes here does it say that I refuse to do an email vote on mandatory mask, which I think is an illegal meeting. Nowhere in this minute does it say that.
Okay, would you like to make a motion to amend the minutes to reflect that? Teresa?
I'm thinking.
Oh, okay.
I'd like the emails that were sent back and forth from the budget committee added onto these minutes. That would be my motion, including my emails that said I believed it was an illegal vote, it's not an emergency situation, and that we should have had a meeting and opened it to the public for them to make a discussion about mandatory masks during a budget committee meeting. So my motion is to take these minutes and add all the emails sent by every single budget committee member meeting, including mine. That's my motion.
Is there a second?
I'll second.
Okay. I couldn't hear that last part?
I said I believe that was the intent.
Yeah,
Yes,
correct,
but there's nothing.
correct.
There's
Yep,
nothing here that
in
says,
principle, I have no objection because that was the intent and that was what Lindsay had asked for, so. If we, okay,
I think that every email that is between the budget committee and the administrator, if it's sent to Chesney, it should be sent to all of us, including, and I'll make a motion because he's not an elected official, that Kevin gets the same emails.
a little
So
less.
he can see,
I mean,
can see and understand what's going on too. But my motion is just to add all the emails pertaining to this vote for mandatory mask, as Lindsay had said in her email, be put attached to this date, November 5th.
Yeah, I have no objection to that because that was what we had informally agreed upon anyway. So assuming, well, actually, let's take the vote on that first. So any other discussion?
No.
All in favor of Teresa's amendment?
Aye.
Aye. Any opposed? All right. Now to go to the original motion as amended. Once those get put in, of course. Is there any further discussion? All in favor?
Aye.
Any opposed? All right. The minutes have been accepted as amended. We have minutes for the October 13th. I'll take a motion to accept those.
I'll make a motion to accept the 13th minutes.
Second.
Any discussion? All in favor?
Aye.
Aye.
Any opposed? All right, the minutes have been approved. At this time, I'll give Ben the floor.
Yeah, before we move on with budget, I'm going to, at 6:05, call the Board of Selectmen meeting to order also. And as this is a budgetary meeting, the chairman of the budget committee is going to have control of the meeting. So
I agree with you, Ben. I don't mean to cut you off, but I was going to say, I'm going to make a motion that at any point in time that the Board of Selectmen can intervene and ask questions as we ask questions of these people. So it's us as a committee that's voting for that. They should be allowed to ask questions at arbitrarily any time that they want, just like we do. And that's my motion.
All right, I'll second it, but right before the meeting, me and Chester were discussing how this would work out, and that's what I was about to go into, is that I think because it's the Budget Committee's meeting, they will start with questioning with whoever happens to be up first, and then when the Budget Committee's done with their questions, the Select Board can ask their questions.
That's fine.
And then the
As long as they
Select
have a
Board-
chance to ask questions.
Right.
Around the same time, I don't care, they shouldn't.
And then after those questions, everybody's done with questions, the Select Board will vote on that particular line, and then the Budget Committee afterwards.
Well, the selectman hasn't called a meeting to order, though.
I just did.
Okay.
Want to hand it back, or do you want?
Yeah, well, do we need the motion that you just made, or can we just,
No, we need, it was made and seconded, so we need to vote on that.
You can
Okay.
withdraw it if you wish. All right.
Just-
Oh,
all those in favor?
Aye.
Aye.
I guess I. All right.
It's your meeting, Chester.
What's that?
It's your meeting.
Thank you. All right, we're going to go down the line as it is presented in the book. So I have a list here of organizations that are not represented at this time, that is best our knowledge. I'm going to read out those lists. That way, if you are here, we know that you are represented. At this time, the Community Kitchen, we're not sure there's we have Community Kitchen. Okay. Child Advocacy. All right. Big Brother, Big Sister. Okay. Red Cross. Okay. MCVP. Oh, no? Okay. Not a problem. All right. So we will start with, I guess, first in line is the Big Brother, Big Sister line item. They're not represented. So what is the pleasure of the committee?
What are we starting with now?
The first on the list is Big Brother, Big Sister. They are not represented tonight.
I make a motion to approve the $400 requested by Big Brother Big Sister.
Is there a second? Is it, all right, is there any discussion? All in favor?
Aye.
All opposed? All right, it passes.
Does the Select Board have any other questions on the Big Brother, Big Sister for $400? All right, I'll entertain a motion to approve the $400 for that. That was Channy and Gloria, in case you guys couldn't hear, because I know they don't have microphones. All right, all those in favor? Aye. Opposed? None, motion carries 4-0.
Okay.
Oh, you'll be able to hear me soon enough. Hang on.
How does this work?
Chester.
Mine fell out.
As a point of reference, does it make sense for the select board to approve the budget first and then the budget committee?
It actually does, and we were going to
Yes.
correct that on the second round. I had thought about that. Thank you, Lindsay. All right. Next on the list is the Home Health Care and Community Services.
Hello.
Hello.
I'm Susan Ashworth, and I'm with Home Health Care, Hospice, and Community Services. With me this evening is Penny Vane, who works with our Healthy Starts program. We are the visiting nurses, the hospice program, Meals on Wheels, and Healthy Starts here in Winchester. Does everyone have a copy of our report?
I do not.
No.
No. Okay.
Oh,
It's in your book.
Oh, it's in the book.
From last week.
If you'd like, I can distribute that so that it's easy to find.
Well, she can distribute. That's fine. Thank you.
I have it right here. Yep.
I got one, I'm all set. Yeah.
This year, we continue to provide services in Winchester despite COVID, and I'm pleased to report that we had 5,624 visits that were provided in the town. That's with our visiting nurses, our physical therapists, occupational therapists, and medical social workers, as well as our home support program. We also delivered 13,676 meals, as you can see. That's an 11% increase from last year. That's largely because we had more requests from seniors who did not feel comfortable going out or could not go out to the store, and we were able to provide not only the hot meal, but a breakfast to meet their needs. We provided over $900,000 in the town. We're requesting level funding so that we can continue in this coming year. That's about 3% of the total funding. This provides care for people who are uninsured for the care that we provide, or a bridge until we can seek Medicaid funding for them. For the Meals on Wheels, we're asking for a slight increase of $111, given that we feel that next year we will provide even more Meals on Wheels in the community, given what's happening. We also employ 8 people in the town of Winchester to help us provide these services. And I'd be happy to answer any questions that you may have.
I have a question. Okay, on that 31,000, on the 31,000, does that include the 6,600 you're asking for Meals on Wheels?
No, it does not. That's
Okay,
level funding, and then the 6620 is an additional for the Meals on Wheels.
Okay, I see that. I just wanted to confirm that, okay? Yeah. All right, thank you.
Any other questions from the Budget Committee?
Does the select board have any questions on either of these two programs?
The only question I have is it just for bookkeeping reasons? If they're coming out of the same, lack of better term, same office, Meals on Wheels and the home health, why isn't it one line item?
We certainly could make it one line item. I think it's just been historically that we've requested 2 line items, and the town has approached it in that way. But I can certainly see that one line item, if it's easier, that would be fine with HCS.
Yeah, I was just thinking about neating things up,
Sure.
you know.
I think the main point that we'd like to make is our request is level funded for the home care, and the Meals on Wheels tends to fluctuate because the numbers of meals fluctuate significantly year to year, but that could certainly be reflected in the one line as well.
Is there any other questions?
Yeah, well, actually, yes, I do have one more question. I don't see it. We have a bottom line of the actual cost of your services provided.
Mm-hmm.
Do you have a number besides contribution from towns? What was the total number that you received either through grants or federal funding, or do you have that?
The 919,000, that is the total amount that was provided in the town of Winchester. So the difference between the 31 and the 919 is what we get from Medicare or Medicaid. So Medicare is about 58% of what we
That's what I was
receive.
looking for, percentage-wise,
Yeah.
yeah. Thank you very much.
Thank you.
Is there any other questions from the select board? Would anybody like to make a motion on these 2 lines?
So moved.
All those in favor? Aye. Opposed? None. Motion carries. Chester?
I'll take a motion to approve these two lines.
So moved.
Second.
Any further discussion? All in favor?
Aye.
Aye. Any opposed? Okay, it passes.
Thank you very much.
All right, next up we have Monadnock Family Services.
Good evening. My name is Mary Delisle. I'm the Director of Development at Monadnock Family Services, and thank you for allowing us to be here tonight to speak with you about our funding request. MFS has been around since 1905, and we've been serving the region with their mental health needs, and while we've been around a long time, those services and programs have changed dramatically over the years, certainly this year not being an exception. We're very grateful for your past support. By virtue of our services, people who we serve from the town of Winchester are leading happier and healthier lives because we're not only taking care of their mental health needs, but we now are also serving their physical health by having a primary care physician available and an on-site pharmacy at one of our team locations. The variety of services provided to members of the town of Winchester include therapy, case management, parent aid, and family support, substance abuse services, nursing, psychiatry, supported employment, which is where our team works with members, client members, to help them not only find jobs, but to remain gainfully employed, and our In Shape fitness and nutrition program. In addition to town and county support, we seek and receive funds in the form of grants, donations from businesses, foundations, churches, and service clubs from the area, as well as gifts from individuals and from our fundraising events, which sadly have been curtailed a bit this year. We're asking for level funding from the town of Winchester in the amount of $5,426. This is in support of the 196 members of the Winchester community served by MFS during our last fiscal year, which is July of 19 through June of 20. 91 of these were children, 96 were adults, and 9 were seniors. A total of 4,654 appointments took place in order for us to provide these services. Our office here in the town of Winchester plays a very important role in our ability to deliver services to your community. Of these services we provided, based on the discounts based on the residents' ability to pay equal just over $108,000. In addition to that, between the time the report was created and what is anticipated by the end of the year, there'll be just under $40,000 in additional uncollectible funds that we anticipate will occur. So at this point, happy to take any questions, but again, we certainly appreciate a request, your consideration of our full level funding at $5,426.
Are there any questions from the Budget Committee? Okay.
Any questions from the Select Board?
Yeah, could you give us an example of and I understand there's no names, and I'm not asking for any names.
Absolutely. I don't have them anyway.
Good. But could you give us an example of the 19% that isn't able to be collected?
Are you referring to a document?
Percentage, no, you have a percentage of payments received for services.
Oh, yes, 81%.
So,
So there's some Medicaid payment, there's some have insurance, some portion of insurance payments, but Medicaid is primarily where our funding comes. We have 3 managed care companies in the state of New Hampshire that we negotiate and work with. So depending on the client and what their connection, whether it's a Medicaid client or they're connected to one of these MCOs, there are negotiations regarding the level of payment, and those rates are set annually. So it's not by an individual client, but it's based on, what the MCOs determine is the right level of funding for any of the 10 community mental health centers in the state. So it's driven by that a lot, but Medicaid is a significant portion of what we receive for funding as well.
Very
Is
similar
that
to-
helpful?
Very, well, it is, because it's very similar to what we deal with as a town with our ambulance. So,
Sure, absolutely.
Any other questions from the select board? Would anybody like to make a motion on this? All those in favor? Aye. Opposed? None, motion carries.
All right, I'll accept the motion if one is provided.
Motion to approve. Was that Christine? Did you say motion to approve? Yes. Second.
Okay, any other discussion? All in favor?
Aye.
Aye.
Motion passes.
Thank you very much.
Thank you.
Community kitchen. How you doing this evening?
Pretty good.
Excellent.
My name is Phoebe Bray. I'm the Executive Director of the Community Kitchen. And the Community Kitchen is requesting level funding of $16,000 to continue to provide food for those in need of our services who are residents of Winchester. Currently, we have 134 residents registered in our pantry program, and up until the end of October, we have served 18,540 meal equivalents to the residents of Winchester. Working on last year's figures, the price per meal equivalent was $1.75, which equates to $32,445. Throughout the year, we have stayed open. In fact, we haven't missed a meal or a pantry distribution through the COVID crisis. And I am super proud that every other food pantry in Cheshire County can say the same thing. We appreciate the continued support from the town of Winchester, and I am happy to take any questions.
I have a couple. How do we know that we're not doubling off on your agency giving meals to people and then one of the other organizations that were agencies that were here or that remain in the audience? We're not doubling up in
I don't
on
think
meals
anybody
or
else
food-
who's
or food banks or
applying
food given out? Pardon me?
I don't think anybody else who is applying actually supplies food to our clients. Meals on Wheels is a totally separate thing. Also, if people come to our pantry, they get 3 days worth of food. So it's a supplementary food box.
Okay. On the back part here, I see Winchester pays 6% of your total, and we're actually, I think, the fourth, within the top 4 of all the communities within this, Cheshire County. And people that have, towns that have more, pay less, they only pay 2%. So, I guess why are we so privileged that we're paying 6% of your
Well,
total cost?
We are privileged that you are paying. What I am trying to work toward is that a town will pay 50% of what it costs us to provide food for your residents. We are struggling to get other towns to agree to that. We are working hard toward it, but other than standing up and, jumping and shouting at people, I don't know what else to do. I do make a reasoned argument at select board meetings whenever I go. But apart from that, I am
I
not.
understand what you're saying. I guess I have a little bit of an issue that the community kitchen, if they're asking for the donation from the taxpayers, that we pay 6%. We have Alstead and Ackworth that has 27,540. We only have 17,901. We pay 6%. They pay 2%. Then we have Jaffrey that pays 2%. We have Swansea that pays 10%, but they're 40,000. I mean,
Honestly, I don't know what to say to you unless you want to go and talk to their select board and show by your example that it can be done.
well, it's not up to me to do that, it's up to something else to happen. The number of households you have down here and the number of residents served, you have a number of households, so how many are you saying number of households in Winchester served?
Currently, we have 134 people registered.
People or households?
People, individuals,
134?
yes.
And how many of those are households?
I don't have that information, I'm afraid.
Anything else, Teresa?
I would have liked to have that right down so I could figure out a percentage wise. I'm just saying that out loud, I guess.
I will endeavor to provide that in the future.
Thank you. Ben, do you have any?
No. Does anybody from the select board have any questions on this?
Well, actually, this is the first time I've seen this, Teresa, and I'm glad you brought it up, because I was just looking at the numbers also. It's pretty staggering that, you know, you have 0%, 1%, 1%, 2%, 3%.
I'm not, I'm sorry that it's gone to your side. I was just going to say something. I'll wait.
I understand there's a need for this. I understand it's a good program. I don't think anyone's doubting that. But at the end of the day, it's paying your fair share. If we just looked at Winchester, now we have the number of people going, maybe a little bit higher than some of these other communities. We'll use Troy, for example. We're double the number of people we're going, but we're 7,000 meals less than that.
Well, that's because people come, you have to come to the pantry.
No, I understand.
Okay.
Oh, yeah, no.
Right.
But what I was getting at, we're 7,000 people less meals than Troy is, and we're paying twice as much.
And that is my dilemma.
Can I ask a clarifying question?
Yes.
We're not paying for other communities.
No.
You're asking for our contribution for the money towards our community.
Yes.
And you're looking for all towns to, at some point in time, come up to 50%.
Yes.
But we're not contributing more from Winchester because another town
No.
is not.
No.
Thank you.
You are almost at 50%.
So the town of Winchester's 6% of the total is actually close to 50% of what Winchester uses.
Well, the 6% is out of the total. The 50% of what I'm asking for is what we calculate that it costs us to feed Winchester residents or to provide food for Winchester residents. I'm asking the town of Winchester to reimburse us at 50%. So I think we're talking about different percentages here.
Okay, so the 16,000 that you guys are asking for, you're saying it's really about 32,000 it cost
Yes.
just for the Winchester residents that use the program.
Yeah.
Yeah, that definitely clarifies a lot.
Okay.
Is there any other questions from the select board? Well, is there any motions?
I'm not ready to vote on this, to be honest with you, because I'd like to do some research on it. First time I said, 2 minutes ago I saw this, and I'd like to, but that doesn't mean you have a forum here, you can certainly make a motion, vote on it. I'm just not ready to.
What's the pleasure of the rest of the board?
Per meal equivalent, it's $1.75.
Was that your only question, Gloria?
Oh,
Does the board have anything else? I mean, I'd like to, I know Jack has more questions, but I'd like to move forward with this. I'll make a motion to approve the $16,000 requested by the community kitchen. Okay, any other discussion on that? All those in favor? Aye. Opposed? Did you vote, Jack, or no?
No, I said I wasn't ready.
Okay.
to vote either way.
Motion carries 3 yeses, 1 recused,
abstention.
1 abstention. Yeah, that's the word I was looking for. All right, Chester.
All right, I'll accept a motion at this time.
So moved.
Is there a second?
Second.
Any discussion? All in favor?
Aye.
Passes.
Opposed? No.
Oh, no, sorry. All right, passes 4-1.
Thank you very much.
And Mr. Marsh, I'm happy if you want to call me at the community kitchen, if you want to go through.
I think there's enough information. Thank you for bringing this.
Okay,
But yeah, there's a lot to go over.
I'm more than happy to discuss
Thank you very much.
it further with you if you want.
Great. Thank you.
Thank you.
for the confirmation.
Have a nice day. All
Thank
right,
you.
next up we have Southwest Community Services.
Good evening. My name is Keith Tebow, represent Southwestern Community Services. I'm not sure if folks have our package.
Yep.
Oh, you'll take a packet. I've got it. Thank you.
I have one.
I have it.
I had it, I just always take a fresh one in case something's been edited.
So Southwestern Community Services is the community action agency that serves Cheshire and Sullivan counties. Myriad of programs: Head Start, WIC Nutrition, home heating assistance, home weatherization, housing stabilization services, and the like. We've been around since 1965. How we handle our requests to towns is we ask them to contribute back to SCS 1% of the money that we've invested in your community, up to $10,000. And there's detailed information in here relative to how many households SCS has helped. We've helped over 1,000 households last year in one way, fashion or another. Our WIC nutrition program brings in provides about $180,000 to your community. Something of note there, we were able to bring a little over $68,000 worth of dental assistance for folks who can't otherwise get dental assistance through that program. Our energy program provides almost $300,000 worth of fuel assistance to over 300 families here in Winchester every year. That's pretty consistent. Other energy programs, we have a Head Start facility in this community and have had it for quite some time that assists up to 18 children a year. There were 8 from Winchester last year, and it will cost for those children about $13,000 a year. So we've provided 2,200 units of service and units to Winchester households. a unit of service, really it varies widely. One unit of service is a child in a Head Start classroom for a whole year. A unit of assistance is a fuel assistance check. Maybe a unit of service would be one of those dental appointments. So 2,200 times we do Touch Your Town. We work closely with all town staff. And so in this case, our request, because we were able to last year provide $1.1 million worth of direct assistance to just Winchester residents. So you hit the threshold, and our annual request to the town is for $10,000. What we use that money for is we're always getting calls from emergencies. Margaret, Shara, and I talk a lot. We come upon people in need. They don't quite fit one of our programs. They need some help, and Southwestern is there. This is an investment to make sure we're there and we have resources available to be in your town regardless of the problem. So we try to be very proactive in working with your town, and are proud to do so, proud of our long-standing history with the town, and I'm available to take any questions anyone might have.
Does anybody on the committee have any questions?
Does anybody from the select board have any questions?
Keith, a large amount of your operating budget is federally funded, correct?
Is federally funded?
Yes.
Yeah, the fuel assistance, for instance, that's a
Right.
that's a federally funded program. Head Start's through the Department of Education. Our weatherization is through USDA.
WIC program.
You know, lots of programs, lots of different. We try to work really hard to get some of the money we're all sending to Washington to come back here, and that's important.
The problem I have is you're basing the amount that you're requesting from the town, less than 1% of the direct assistance, but the direct assistance, majority of it is federally funded. So you're using federal money to base off what you want to ask the town for assistance for, which is, I guess that's the only formula that you can use.
Yeah, what happens is the federal money has very narrow parameters, and we get calls for assistance for all kinds of things.
And I understand
that's what these funds are intended to help us with.
I apologize. I do not have the figures with me this evening. I wish I did. Your budget is basically doubled in 2 years, from last year's actual to this next year's requested. We as a town probably lose close to that in taxation. And for the audience or the board members that don't realize, and it's no dealing of Keith, but a few years ago there was a state law passed, and you're well aware of it.
Mm-hmm.
You might have done some lobbying for it, I'm not sure.
Yeah, did.
Basically, the housing that Southwestern is involved in, the town no longer receives the taxation of the assessment from the property, like your house, my house. It's a formula that is calculated on the income. And majority of the properties are based on low income. So we lose out. Amy, do you have, actually it would be Carrie probably, do you have any idea what we're losing out on? I know we've seen the figures here. I apologize, again, I don't have them.
Mm-hmm.
Yeah, because we have, I don't know how many properties you have.
There were 4 different developments.
Yeah.
So some are more than one building.
So, that being said, I'm going to make a motion to deny this 0L, because I feel like we already given quite a bit more than what they're asking for direct assistance, and the loss of revenue from taxation.
If I could just make a comment or two, the developments he's talking about are developments that are developed with the low-income housing tax credit program and designed to assist people who are at or below median, 60% of the area median income. The state passed a law that tells us what we must pay to the town is 10% of our gross income that comes from that development, not necessarily what an assessed value would do. Because quite frankly, any other way, we wouldn't have those at all. Those could not afford, because the rents are set by the program. So we're getting, for a 2-bedroom apartment, we're getting roughly $750 a month rent, and that includes heat, hot water, electricity, and so forth. So we're providing housing for folks who would really struggle, maybe at the town for town welfare more often. So that one particular piece of our program, because we can't set the rents to what it costs to run the buildings, the program sets the rents that we're here. So we don't have the luxury of raising rents to pay more taxes. This law was put into place for the whole state so that these housing developments can afford to operate in the communities where they are. So, you know, if indeed it went back to the normal fashion, we'd just close the doors. We couldn't pay the property taxes on those. So this here is this town funding, every other community in the 2 counties does contribute to the level at which that we've asked. In some towns it's as little as $300, and other towns, Swansea, Keene, Claremont, Newport, and Winchester hit the $1 million mark. So it's beyond what we're doing in providing housing for very fragile senior citizens and others. We're also doing a myriad of other programs in your community, and your community calls us to help. And I'd like to say, we're here. We come here, and it's on an ongoing basis. We're discussing very difficult cases in your town. So the assistance here that we're asking for is just to allow us to be able to do that and be able to provide assistance. We're following state law on our housing developments, and we're pleased to be here and be able to provide those important housing opportunities for the people who live here. Where they live otherwise, I don't know, quite frankly. And it's.
But this $10,000 doesn't impact whether they will continue to live in those places and continue to benefit, though.
Right.
Correct?
This is generally to help people who aren't being helped right now in one fashion or another. Oftentimes it is with housing too that we get people who fall through the cracks. We help them with fuel assistance. They may need a little bit more help. Heating system breaks. We can often find the funds through this program to help fix that sort of a problem. So this is the beauty of.
Could you explain to us how that money was spent specifically in the manner you're saying? Because I know you're saying it can be used, but can you tell us how it was spent?
Excuse me, Keith. Point of order, Mr. Chair.
Oh, sorry.
Without wasting people's time maybe, we're in a discussion part of a motion that hasn't been seconded.
Correct.
So it may not even warrant the discussion if it hasn't been
I'll hold on my question.
Okay.
Does anybody from the select board want to second Jack's motion? All right, motion's been made and seconded to zero the line for Southwest Community Services. Any other discussion on that? All those in favor?
Aye.
Opposed? No? Gloria, did you vote? No. I can't hear anything from that end of the table.
I couldn't hear her.
Yeah. No. You voted no? Correct? Okay, motion fails 2-2. I will entertain a motion to approve. Well, I'll make the motion to approve the $10,000. If somebody would second it, I'll explain a little bit. I 75% of the way agree with Selectman Marsh. I don't care for the way the tax formula was created. However, at this point in time, I'm only looking at the services offered through this $10,000, and this I do support.
Thank you.
Is there any other discussion from the select board? All those in favor? Aye. Opposed? Motion passes 3-1.
Appreciate that. Thank you very much.
Chester?
All right, I'll accept the motion at this time to approve the 10,000.
So moved.
Second.
Is there any discussion?
Just a point of reference, Jack noted that there was a significant increase in their ask over last year. And I just wanted to clarify, I believe what happened was either the select board or budget committee reduced that line because their ask has been pretty consistent. And so their increase went up less than $1,000 actually. At some point in time, one of these committees reduced what the give was, not what the ask was.
That's right,
So
it's
just
cut in
to
half
clarify.
one time.
We did.
I was looking
Yeah,
for my notes.
last year, the budget committee reduced it.
I think it
Thank
was
you.
me. Left out today.
All right, is there any further discussion? All right, all in favor?
Aye.
All opposed? All right, it passes.
Thank you very much for this support and the past support you've shown our organization. I appreciate it.
Thank you.
We'll be there for you.
Have a good night.
Thank you. Can we make a motion before we hear from people or wait a minute?
Next up will be the Child Advocacy Center.
Hi, everyone.
Good evening.
My name is Phil Huber. I'm the Development Director for the Child Advocacy Center and the Granite State Children's Alliance. Thank you for your continued support of the CAC. We're requesting the same amount that we received last year, which was $2,500. Frankly, very generous. We recognize and appreciate that. The CAC was deemed an essential service by the New Hampshire Attorney General during the shutdown period. So we were able to basically keep our centers open. It wasn't that surprising that our caseload during those 11 weeks was significantly down because children were not seen outside their homes. And it was widely expected that once children were outside again and seen in their neighborhoods, that our caseload would increase. And that's in fact exactly what happened. So during the shutdown period, we were basically gearing up for, really a kind of a heartbreaking onslaught of reported child abuse cases through the summer, and that's continued through the fall. I don't need to tell anybody that, these cases are just really heartbreaking. But when the children visit our center and are enabled to disclose their abuse, that's the first step towards healing. And that's, in addition to prosecution of the cases, obviously the child well-being is of paramount importance. And we hope through the CAC system that our kids can meet our motto, which is to survive, heal, and then ultimately thrive. And in many cases, that really is what happens. So I'm happy to address any questions you might have.
How many children did you service last year? This year you say you serviced this year 14.
Yeah, it was down a little bit from, I can't remember exactly the number. Our cases vary widely year to year, so it's not like there's not a linear trend in any community, except for the really large ones, particularly like Manchester and Nashua. So it's not unusual that our caseload would go up and down year to year. The key thing is we have to be ready for cases to be disclosed, or reported.
Okay, last year, Lindsay, so I couldn't find my notes, 15 to 20 cases per year in Winchester. Last year, there's 14 now. By motion, I guess, I'll wait for my motion now, if there's any questions.
Is there any other questions? No? Ben?
Is there any questions from the select board?
I just have one question. Do we have a representative from KSAT?
From where?
Casa? Yes.
Yeah. Did you have anything? Do you really have anything else that you is not in your publication here? You print out. The reason I ask is because I was going to make a motion if you would, Mr. Chair, to approve both yours and yours at the same time. Because I think they're both worthy causes that, quite unfunded throughout the state. And a little bit that we can help out as a town, that we need to. So that is my motion that, the Child Advocacy Center, 2,500, and Happy for $1,000.
Is there any other discussion or questions on either budget from the select board? All those in favor? Aye. Opposed? None. Motion carries.
Okay.
Go ahead, Chairman.
Okay. Are there any questions to be asked? All right. I would accept a motion to approve the budgets that were just approved by the select board.
Make a motion to approve the Child Advocacy Center and the CASA budgets as listed.
Second.
All right. Any further discussion? All in favor?
Aye.
Aye.
All opposed? It passes.
Greatly appreciated. Thank you.
Thank you.
Thank you.
See you next year.
Thank you for coming.
Thank you. Unless you want to talk and so we can, like, second the motion to reconsider it and lower your budget.
Understand the happy organization, how much we appreciate it, and thank you.
Thank
Thank
you.
you.
She won us over with oratory. All right, next up.
Red Cross.
The Red Cross, they are not represented tonight, so we'll have, I'll ask for discussion.
I was really hoping there was going to be a representative here for the Red Cross. I know they don't have an office local anymore, but I do know that from them working with me after my house burnt, they do have representatives in the area that are still reaching out and helping people. But like I had to meet them in a parking lot and then do everything else over the phone after that, but they did still help.
I need to know how many people, like fire emergencies, that they help. So just to let people know, I'm gonna make a motion to zero that out. I'm not making it now, to zero it out. I mean, I think that if the administrator called them and had a cell phone number that they could be reached at and had questions like how many people that they actually serviced in Winchester,
Yep.
that would have been beneficial. And, you know,
Actually, we may have a question on that point.
Okay.
Their
Huh?
reason for not attending was because they're not
Yeah.
currently attending in person.
And I get no problems with that. You know, I understand the COVID thing, but you know what I'm saying?
Yeah, because even when I had to meet them, like their policy that they were given
Yeah, I mean, I
was
get
like,
that. I got-
they had to
I
leave
got
the
no problem with
envelope
that.
on the hood of my car and then get back in their car before I got out of my car to get the envelope, and
Thank you.
Yeah, I got no problem.
it was very strict.
I'm not gonna vote for money unless I got some answers, you know?
No, I get it, I agree 100%.
I guess you were one of those disasters, huh?
Yep, I was one of those disasters.
I'll give the committee a moment to take a look at it, and then we'll ask for questions. Or discussion, I mean. Any discussion? Has everybody had a chance to read what they need to? All right, I'll wait.
Does the select board feel like they're ready to make any motions on this, or?
I'll second for discussion.
Okay.
Why was it zeroed out last year?
Last year, I know we zeroed it out because they didn't have a local office anymore.
We zeroed it out last year. I can remember me making a motion to zero it out because it wasn't during the pandemic and they didn't bring any representatives to give us information pertaining to it. So I felt that at that point, if they weren't interested in coming for 15 minutes to explain to us how many people are serviced in Winchester through Red Cross, that we weren't going to give them any money in order to support that program.
And I believe we were saying in the prior year as well.
Yeah.
And Jack, I'm not saying anything, like, this is a special situation. If people didn't show up tonight, I have no problems with that at all, because of the situation we're in this year.
But admittedly, it was their policy in the past to not send anyone, so.
Right.
And that's why
Send
we
a
keep-
representative to say why you want money from us.
Right.
Which is why we zeroed them.
Is there any other discussion from the select board? Motion's been made to approve the $800. All those in favor? Aye. Opposed? No. Motion fails. Is there any other motions, or? Yeah, it's gonna be. All right.
All right, at this time,
I
I'll
would like to make a motion. I know they help people, and I know they help people in Winchester, but they still haven't, so I'm gonna make a motion to put the amount of money at $400 as opposed to $800, so my motion is for $400 to the American Red Cross.
Is there a second?
I'll second Teresa's motion.
All right, is there any discussion?
Just for my own clarification, the blood drive that the Elm usually does, that's with the Red Cross, correct?
Correct.
I don't get blood, so I just wanted to verify.
Yeah, but they did it at the school.
They did it at the school one time, but that's run through the Red Cross.
Right.
Right.
They did it down here.
They used to do them at the VFW.
VFW too, right? I don't think I would give blood.
Is there any other discussion? All in favor of Teresa's motion to reduce it to $400, say aye.
Aye.
All opposed? Nay. All right, it passes 3-2. Okay. Next up, we have 100 Nights.
Hi, everybody.
Hello.
Hi.
Mindy Combier, Director of 100 Nights. Thanks for letting us come back and visit again this year.
Can you speak up just a little bit louder for me?
I'll try.
Is that thing on?
The microphone's a little low for me.
Okay.
But I will try. The mask thing's difficult, just more of part of the challenging year, right? So I don't remember the exact date that we came in to meet last year, but I wanted to tell you the story of what's happened with 100 Nights over the last year. Last November, St. James Episcopal Church in Keene offered up their undercroft space to provide 12 more cots so that we had a total of 48 beds through the winter. They were filled as soon as they opened the space. In March, when COVID happened,
The United Church of Christ had to close their overflow space for us, so we lost 12 beds because they had a requirement that one of the church volunteers spend the night in the space sleeping on a cot with our overnight awake staff. So when we lost the 12 beds, we had a scramble because they were full at the time, and our new landlord, who is Patty Marino, came and basically offered us the 2 rooms above Timoleon's restaurant to use as overflow space for the time being, which lasted until July 15th. So we were still down 4 beds. They stayed full all the way until, so St. James closed their space on June 15th. Patty took her space back on July 15th, and we were back to 24 beds. It's very challenging. My staff has been working this whole time, as have I, on site. We have taken some steps to try to make the whole space safer. We have put up flame retardant curtains as barriers between the beds. We have, the plexiglass shields up between all of the eating tables. At that time, our resource center is literally the size of the stage, and that is where people go during the day. So we were trying to fit 48 people in that space, which was very difficult. It meant that we had to rotate people in and out. So we had probably 10 people maximum inside that space at one time, and then had to have everybody else waiting outside for their turn to rotate back in. So people were outside for 45 minutes, an hour, and it was still pretty cold. What happened then was that Monadnock Family Services had a space on Main Street, the old Monadnock imaging space. They donated it to us for 2 months to use as our resource center, which was great because it had 2,400 square feet, and we were able to bring everybody in separated pretty relatively safely. Everybody has to wear a mask unless they are eating or sleeping. We've instituted all the standard COVID measures. It was an extremely difficult time for people who are homeless because there was no place at all in town for them to go except for 100 Nights. No library, no community kitchen, just us. We all got a little tired of one another's faces, quite frankly. So then we started scrambling in July because we knew that possible evictions were coming. People were losing their places, and I know of one woman with 2 children in Winchester right now who is currently being evicted, just as an example. But we knew that we had to figure out a way to make up the 48 beds. Now, I don't know if you all know about this, but we have been trying to purchase a larger facility for going on 5 years now, and we have been basically thwarted at every turn by zoning regulations in the city of Keene. I get it, it's a process. We will eventually get to where we need to be, but just since July, we are now on plan, probably, I don't know, H, I, J, I don't know, somewhere in there. We had the opportunity to, with the COVID CARES Act money for shelters, we had the opportunity to actually purchase property, which would have meant that nobody had to contribute a dime. It was coming already from the federal government. All right, we've already paid our taxes, but I mean, new money to be raised from the community. So we found property. We thought we could purchase the property we're interested, which is on Water Street in Keene. We had to go for a variance. At the same time, we found the old downtown fitness building on King Court, which is where the old Indian King Framery was. The owner agreed to long-term lease to us for 2 years. There was also CARES Act money available to cover a long-term lease. We also had to go for a change in non-conforming use for that. We applied for both of those variances and change in non-conforming use in August. We were supposed to be on the agenda on September 2nd. We got pushed back to September 22nd. They only heard the Water Street variance, which passed. They put off the King Court non-conforming use change until October. In October, they postponed it to November, and in November, they postponed it to December. We already know that all of the abutters around King Court have hired lawyers, and they are threatening to appeal if it passes. The Water Street variance, which passed, was appealed on day 30 at 4 p.m. The zoning board reheard it and refused to step down. They stood behind their decision. So now the Water Street property has another 30 days to go to see if the abutters file an appeal in Superior Court. So my point for telling you all of this is that all of our plans for all of the shelter, CARES Act money, COVID money, county money, everything, the timeline just did not work out. So we have basically lost our opportunity with all of those buckets of money. We then tried to purchase a property on Roxbury Street that came on the market on a Friday. We looked at it on Friday night. We made an offer on Friday night for $50,000 over the asking price, and there were 3 offers, $50,000 over the asking price. They decided to go with us if there were no problems. This was in the only zone in Keene that we could slide into, that we didn't need a variance, but we needed a change in use. So then we got a call from the city saying that we needed 22 parking spaces because we're a lodging house in their terms. 1 bed required for every 2 beds, 1 parking space required for every 2 beds. And there were also apartments that needed parking spaces. And we said, but homeless people don't have cars. So we talked about that for several hours, and we went back and forth. And finally, the city manager and the chief of police basically decided that they would allow us to park on the street temporarily for 90 days until we could get the variance, meaning that it could go to the planning board. It was the long weekend in October, and apparently nobody told the planning board that that was the case when we brought the papers in to file the change in use to have a special meeting, and they refused to take the paperwork. So we were then told by the seller that we lost that property as well. So now we're on, I don't know what plan letter it is anymore, but we have our 24 beds on Lamson Street. They're full. We then got word that the Keene Inn might be willing to negotiate with us about a block of rooms. We talked to the Department of Health and Human Services at the state level because they have emergency service grants available due to COVID for shelters. And they said that if we could negotiate some price with the Keene Inn, they would actually cover paying for 10 rooms. Turns out that the negotiated deal is $280 a week because we have to pay the 9% room tax. So I have spent yesterday and today filling those 10 rooms with people, basically the people that we know really well, who we know are not going to trash the place, the people we know are not alcoholics or drug users and are going to take care of the property because that is what we need them to do in order to maintain this contract. The rooms are rented through April, and tonight, after we moved 15 people out of the shelter into these 10 rooms, we have 26 full beds again tonight. Cool. And I know that there are still people in the woods. Because I was moving people into rooms all day, I did not bring any of my information from last year. I don't even know what I sent you this year, but I'd like to tell you some of the numbers for Winchester in 2020, or in general. I know that
it's the numbers for 2020, because I have your
you have
printout
the
for
2019,
2019.
I believe,
I
yes.
need 2020.
I have 2020. So far in 2020, we've had 181 people who have spent 9,061 bed nights at the shelter.
How many people?
181.
And you had 3 the year before, so it went up substantially then, right?
Last year we had 219 people total.
It says here, those, there were 3 people with ID Winchester who needed shelter during 2019.
Oh, from Winchester. I didn't get to the Winchester number yet, I'm sorry.
Okay.
I'm talking about total. Total first, then I'll do Winchester if that's okay. We had 219 people at last year with 8,340, I believe, bed nights of shelter. This year so far, so that was for the whole year. This year, through November 17th, we've had 181 people and 9,061 bed nights of shelter. We've had 12, 15, 16 children this year so far. And from Winchester this year, there have been 5 people who have stayed 131 nights. Our approximate cost is $30. I don't have the exact number yet for 2020, but I can tell you that between last year and this year, our budget has gone from about $360,000 a year to over $500,000 due to all the COVID-related expenses that we've had. Yeah, it's been relatively crazy. I don't know what else to say.
Thank you. Are there any questions? Nope.
How many people in Winchester, from Winchester only, I don't want all of Cheshire, used the resource center between the same time that the 5 people that did the overnights?
That is the notes that I forgot to bring with me. I'd be happy to send them to you tomorrow.
Okay.
I'm sorry.
And so you're indicating now that this year, in 2019, it was, let's see, it was $25.37 for those 3 people who needed the shelter overnight.
Per night.
And so, yeah, per night. So it's gone up almost $5. You said almost $30 now?
Because of all the COVID-related expenses, yes, our budget is way up.
Are you getting any state or federal funding because of the COVID to support your program?
So what we were able to apply for and get was money that we could use to modify the shelter space. So the flame retardant curtains between the beds, the plexiglass shields. We have an air purification system going into the shelter and into the resource center space. And if it's approved next Thursday, this coming Thursday, there's the potential that we might purchase a coach bus that's been transformed into a sleeper bus because we are still short 12 beds. So we haven't gotten direct operating cost money, for example, all of the hand sanitizer and sanitizing cloths and all of that kind of stuff has not really been covered completely.
Just answer this to me, because I'm having a tough time understanding. And I'm basing it right now on the 2019, but you can answer it for 2020. Say 2019, 3 people spent overnight, were granted access to the shelter, and they spent a total of 177 bed nights in the shelter. So 3 people and 170, they got to stay at the shelter for 177 nights.
Yes. Total. So
Total.
approximately 60 nights each. And the average length of stay in the shelter for a person this year is closer to 5 months. It's
closer
been
to
very
what?
difficult to get people into housing.
So those 3 people didn't have families, obviously, because there's only 3 people we're talking. They don't have a family that comes in of 4 kids and a husband and wife that's out of work because of
There
COVID.
was a woman with a daughter, and there was a single person last year. This year, I don't recall off the top of my head, but I know there was 5 people.
I just think that's like an astronomical amount of time unless you have children. Now, during COVID, you got parents out of work. I can understand, but for 3 people to spend 177 nights, or 50 nights each, whatever it is, more than 50, 177 divided by 3 is more than 50 nights, right? Closer to 60.
Yep.
And now we have 5 people
Yes.
from Winchester. So,
5 people and 131 nights so far.
and how what?
And 131 bed nights so far.
Good.
How much of this money goes towards the Winchester people and not towards, how much are we using towards buying building and air conditioning and the hand sanitizer and that stuff? How much does this money actually help Winchester?
Well, so we take the amount that it costs us based on our operating expenses and divide it by the total number of bed nights or people to get the amount that we ask for. So the amount that we asked for, 3,500, both last year and this year, was to cover the resource center and the shelter. And this year, the shelter cost alone is 3,930. And as I said, I forgot my notes about the resource center. So I don't think I can, over 78% of our budget goes to direct program costs as opposed to administration. I can tell you that. Excuse me?
You say 79%?
Yes. This year.
All right. If there's no other questions from the committee, I'll hand to Ben.
Does the select board have any other questions?
Yeah, I was just going over the amount that you had received 2019 and what's budgeted this year, 2020, from all the towns. Last year, it looks like you, less than half the towns requested, funded anything.
That's true. That's because we have had only a few people who can go to all of the town meetings, and we try to include a couple of new towns every year on our list to try to get to. We send the request out to everybody, but the ones who don't respond are the ones that we need to, I was going to say hammer on. I realize that's kind of inappropriate, but that's kind of what I mean. So because there's only a few of us who are able to go out to make the presentations, it makes it very difficult because so many of the meetings are on the same day or similar times. But we have made progress. I mean, less than 5 years ago, or somewhere around 5 years ago, we only had 3 towns who donated. So we have been making some progress in that area.
Cool.
You have 8 towns this year that are not donating.
And there are several towns who have had no people come in ever. Surrey, Roxbury are 2 that come to mind, and I know there's at least one more, but I can't remember which one it is off the top of my head.
Well, what I was trying to do is compare within reason the numbers, which you did a very nice job, thank you. That's what we're always looking for, is some good numbers. Looking for the numbers of, people that you've helped with the other towns. And there's a couple that we can compare that are within 1 or 2 people. But it seems like, if you, this is budgeted for this year. Let me go off the requested amount. You're level funded. You're asking $3,500 this year from Winchester.
Yep.
Hensdale, about the same size, $1,500. Fitzwinger, $1,250. And I would say that's probably about, Chesterfield's smaller, but I would guess, or maybe Marlboro, it's 1,000. So, looking, and those towns that I just mentioned, they all had some visitors. They were, majority of them were lower in the total number of nights used. I believe, Teresa, what you say, 177 nights? Added 3 people last year? Yeah.
Yep.
Yeah, so, but they were within, you know, an arguable number. So it's just, the next closest one, you know, we're still $1,000 or more. Not,
So Jaffrey increased their allocation to $5,000 for this year, as one example. The
yeah,
city,
there's a couple of good size increases. Town of Swansea. This budget here, you're $2,500 and you're requesting $10,000.
I am,
What
because there was
about
an
You know,
enormous increase in Swansea IDs who came in for shelter.
yeah. I guess I'd be curious to see if you get it.
Well, I wouldn't be surprised if they did not get $10,000, but I'm hoping that that will encourage them to at least increase it.
Yeah.
That, you know, it's not easy coming in front of this group of people in every single town and having to justify everything. I mean, I have no control over the kinds of decisions anybody in any town is going to make. You know, I don't. I have no control. All I can do is present what we do and how we do it, and ask you to be as generous as you possibly can be. That's all I can do.
Yeah.
If you have more specific questions about budget that you want answered, anybody here, I mean, I'm happy to do a one-on-one or small group anytime, except in the next 2 weeks.
And we hear you might be
Because
busy.
I'm going to the ocean.
It's difficult for me anyways, because I'm looking at these numbers for the first time tonight. And you have, what is that? It's 20 some odd towns, you know, that I'm trying to compare.
Yes.
And I'm trying to look at the increases or, I guess there's no decreases. But that's what I was trying to do. I was trying to compare our increase percentage-wise over to the percentage-wise of the other towns.
Yes.
Out of the town of Winchester.
Well, I'd love somebody to come with me to the Hinsdale Budget Committee, if you're interested.
Is there any other questions from the select board? Would anybody like to make a motion on this?
Not at this point. I want it. A lot of great information. I'm glad. It's a great cause. Very needed. Right before this meeting, my wife and myself were up at the Resource Center. So we saw the people that were there using it.
Is the rest of the board on board with tabling this? Right. Chester?
At this time, I'll accept a motion if one is presented.
Make a motion to level fund for 100 nights at $3,500.
All right, is there a second? I'll second. Any discussion?
Just for the record, I'm going to abstain from voting because the company I work for is their landlord. I work in the building, so.
Okay.
I'd like
You want
to,
more money, ask for a break on your rent.
yeah, really.
Yeah.
I'd like to just
Good
let
luck.
you know, I stood up because I have a back problem, not because I have to stand up every now and then. It's not, I didn't hopefully show any disrespect to you. I'd like to see that at like $2,500 right now at this point. I mean, we can table it or whatever. I just need a lot more.
Well,
I
if you-
just think
yeah.
3 people or even 5 people now
If that's a
5
motion, I mean,
that's how I look at it. It's really 5 people, I mean, I know people use the resource center, but we have 5 people and no substantiated, like, families are there. There hasn't been a substantial increase from 2019 to 2020. And they're asking for like $1,000 more.
No, we got
No.
3,500 last
It's
year.
the same amount. It was
No,
the
I
same
have,
from last year, 3,500 this year. Yeah.
oh, okay, I misread that then. I apologize to you.
I have a quick question.
Okay, I apologize for that.
When you say visits, is that to the resource center?
Yes.
So 530 visits to the
People.
resource center.
530, whatever it was.
Yeah.
People came into the resource center, I think it was about 13,000 times. So if somebody comes into the resource center once on Monday, that counts as one. If they come in again on Tuesday, it counts as another one, so that would make 2, and so on and so forth.
I was just looking for some perspective. So, for instance, the majority of the other towns, except for Swansea at 800, and, sorry, I was going backwards. Swansea at 800, and I'm guessing Keene at 6,000. We were the next highest amount of visits to the resource center.
Yes.
And people visiting the resource center aren't necessarily staying at 100.
Correct. They're not all staying.
They're just utilizing that service.
Yes, and people can come in and, for example, do their laundry, have breakfast, lunch, or dinner on weekends. Dinner during the week, people eat at the resource center, but they get it at the community kitchen first. They can make use of our case managers to help them with job search or resume writing, or until COVID hit, we were also doing classes in like anger management, bicycle repair, anything you could think of that somebody wanted to offer a skill workshop, whatever, in to anybody who is interested.
So we might not have a lot of people identified as Winchester residents that end up staying in the shelter, but we have certainly the 3rd highest population that's utilizing the resource center.
Yes.
And is that still in effect, even though the COVID and the requirements that you have, that there's 530 visits? Because you'd have to probably cut down on the number of people in the resource center itself.
Right. So like I said, Patty Marino donated MFS donated the resource center space to us for 2 months earlier, and just a few weeks ago, St. James Church thrift store closed, and they offered us that space to move our resource center into, so again, we can fit, 30 people in there, all spaced appropriately.
Gotcha.
That's a lot of use of the resources. I'll stick with my 3,500 level funding.
Is there any other discussion? All right, all in favor of Lindsay's motion at 3,500, say aye.
Aye.
Aye. All opposed?
Abstain.
Okay, it passes 3 yea, 2 abstention.
Thank you.
Thank you very
Thank
much
you.
for coming in.
Thank you.
Call
Sorry
me
I
if you
misread
want to
that.
talk more.
I probably would have been okay with it. I misread it. Okay, 3,500.
Mr. Chair, can I ask to be excused for 30 seconds? You can continue on with the meeting.
Yeah,
What are we doing?
I just need to be excused for like 30 seconds to run into the office and back. You can continue on.
all right. Next up, we have NCVP, which is asking for 3,591. This is an increase from 1,000 last year. NCVP, which actually may not be here. Okay, so they are not here yet, or they're not here at all. Last year we gave them 1,000. This year they're asking for 3,591, and they did not send a representative this year.
Hey, wait a minute though. I think I had a question on it.
Actually, you know what? Well, you're here. Let's talk to you now. What?
Well, That's your CVTC though, right?
Yeah. So we're gonna skip to CVTC so that you can.
Oh, I'm CVTC,
Is that, yes?
Community Volunteer Transportation Company.
That seems right.
I gotta say, I read your thing and I really like that, dear, because I had a question on it and I, right off,
Oh, you guys are gonna have to speak up because I forgot
You
to
did
put
a
my
good
little
job.
helpers in my ears.
All right, so we'll skip to you then. So since you're here, go ahead and talk to us.
Okay, well, thank you all. I have to tell you that, Mindy left, but way back when in the 80s, I worked at Keene State, and Mindy was a student, and that's where she started the community kitchen.
Really?
And now she's running 100 nights, so, and a lot of us that were sitting back here, I mean, we've been sharing these stages for many years, and, the town's really, the town contributions really mean quite a lot. So my name is Ellen Avery, and I am the executive director for the Community Volunteer Transportation Company, otherwise known as CVTC. We're based in Peterborough. We serve 34 towns in the Monadnock region, so we go over into western Hillsborough County and up and down Route 202 and those towns over there. Let's see, we've been in business since 2008, and our model is so simple. It's volunteers, drivers using their own cars. So we're in the transportation business and we don't own a vehicle. So the volunteer drivers own their own cars. They can elect to be reimbursed. We get federal money for the mileage reimbursement, and earlier this year we were paying 41 cents, and because of COVID, where our participation numbers went down, we upped it to 57.5 cents. And we're probably going to keep doing that all the way through the rest of this fiscal year, which for us ends in June. So for those of you that don't know about us, just think about this. Taking care of yourself can't be on top of the list if your day-to-day responsibilities and needs aren't being met. I mean, you just heard a whole bunch of those reports from other agencies. But this is where CVTC comes in. By providing transportation services, we help meet basic life needs, making it easier and less stressful for people to focus on their health. We do not charge for our rides, and we take all who call. So depending on their age, their ability, their economic situation, or their limiting circumstances, we're not taking all kinds of information from our riders. Our trip purposes, we don't do everything, non-emergency medical and social service appointments, as well as trips to the grocery store, the pharmacy, the bank, and the post office. And that's it. And we will, for people that are temporarily not able to drive, for whether they don't have a car or they got caught with a DUI or whatever, we'll also do anything to help them be able to get back driving. So whether that's somebody that's recuperating from surgery or somebody that needs to go to court to get their license back, I mean, we will help them do that as well, but that's few and far between. I shared with you that I think in our letter that do you all have our letter?
Yeah.
Okay, great. So I can update you. Well, one of the things I want to share with you all is the last few years, we didn't get funding last year because I didn't show up for this, so I got zeroed right out. So I made sure to be here this year. Since we started serving Winchester in 2016, and one of the issues is for us, the livelihood of our organization are our drivers, our volunteer drivers. And Winchester now has 2 that live in town and that are taking people, not only people in Winchester and Hinsdale and all that, but they're also taking others as well. So chops to Winchester, you went from 0 to 2 drivers, and that's really wonderful. So I am asking for, requesting the rate that we asked for before, which is $500. Unlike these other organizations that are giving you figures, you know, it costs this much or that much, ours isn't based on that. I would say that any town that is doing business with us, and, you know, Winchester's slowly picking up. I know that there's another volunteer driver organization that also comes to Winchester, so our numbers aren't as great as maybe they could be. But the standard rate is $500, and I will tell you that Jaffrey, Ringe, and Peterborough, we're serving like upwards of 40 people. You know, in Winchester we're serving 6, and in here right now we're serving 6. When I wrote this report, we were for last fiscal year, we served 10 individuals here. But $500 is the standard rate. And Jaffrey and Peterborough are paying over $1,000 each. So it's, but the numbers prove it. So that's how we have some towns in the region that we haven't served anybody in the town, and we ask for $100, and sometimes that works, sometimes it doesn't.
Fair enough.
So we keep at it. Last year we had, out of the 33 towns that we solicited, 22 towns participated.
Good.
Questions?
Any questions?
I don't have a question. I'd like to make a motion.
We have to defer first to the select board.
Oh, okay, I'm sorry, that's right. I forgot about that.
I have a question. You said we have 2 drivers that drive here in town. They might also drive other towns as well, correct? Right. But you can't really identify how many people they're servicing?
Well, in the town here, I mean, right now I've got...
Oh, it's the 6.
Yeah, from January, not to confuse you guys, but for the calendar year, I mean, right before I came, I looked at it. So from January 1 to today, we're serving 6 individuals, and with these individuals, we've driven over 2,000 miles. I will tell you that we have one woman who, once a week, I think on Thursdays, she goes to the community kitchen to pick up her basket.
Thank you. I missed
Does that answer your question?
Yeah, thank you.
Yeah.
All right. Ben?
Does anybody from the select board have any questions on this? Would anybody like to make any motions?
So moved. And thank you for coming in. It does mean a lot to us to see your smiling face. We don't have one. Up to a couple of years, we never saw anyone. We didn't know where the money was going, how it was used, so it's nice to...
Yeah, and I have some cards, and I'll leave them with Carrie, but these are cards you can hand out. One side is about becoming a volunteer driver, and the other side is getting a ride. So.
Yeah, perfect, thank you.
Thank you.
Well, was there a second to Jack's motion? Yes. Gloria? Okay. No other discussion? All those in favor? Aye. Opposed? None, motion carries.
I'll accept a motion if one is offered.
I make a motion to increase, to have that line item at $750 as opposed to the $500. This is an absolute wonderful organization with COVID, and so I hope they pay special attention to some of the elderly people that have to go to medical appointments, and I think it's wonderful. $750 is my motion.
Is there a second?
I'll second.
Is there
I
any...
just had one follow-up question, I'm sorry. You're the only agency that services and provides this kind of like free ride for whomever?
Actually, there's another organization by the